All right, let's take a really quick listen and see what sound this is. It sounds like croup. Dr. Hassan-Ali here, double board certified pediatrician. I just finished call this Thanksgiving and I had so many patients with croup. So let's talk about 5 things you need to know about croup. So number 1, what is croup? So croup is an upper airway infection, not a lower airway infection. It causes inflammation and swelling of the larynx and the subglottis. It's caused by very common viruses that are in the community, and it can lead to airway narrowing, and that causes the barky cough, as well as an inspiratory stridor, which is a whistling noise when you're breathing in. So number 2, if you have a child with croup, what do? Very, very important is to remain calm. I know that's very hard when you're seeing your child suffering, but the most important thing in these situations when you may have obstruction of your airway is having the child placed on your lap, very calm, and head to your nearest hospital. Now, you may be hearing things about what you can do at home, and number 3, there aren't really good therapies that you can use at home. So things like humidifiers or mist therapy don't really work in diseases like croup. And the reason being is that because there's airway swelling and obstruction, and you can't really use mist or humidifiers to really get the air in. So if you are using a cool mist humidifier and it is working, it's probably more of a placebo effect, or it may not be croup at all. So number 4, how do you treat croup? Well, there's 2 therapies that we can use. One is to reduce the inflammation, such as steroids or dexamethasone, and you only typically need 1 dose. And number 2, the other way to improve our croup is by opening up the airways, and then we can do that with what's called epinephrine. Those are medications that you can either get at an urgent care or an emergency department. If things like dexamethasone or epinephrine are not working, then again, we must think whether or not this may be croup or something else. And lastly, can you get croup again? Sometimes you can. There is something called recurrent croup, and usually there aren't any typically long-term consequences of having it. As always, if your child is in daycare or in school, practice really good hand hygiene and use a hand sanitizer when you can. And if you're coughing or sneezing, use your elbow to prevent any type of droplets getting into the hands and the mouths of other children. Please make sure to follow Pete's Patrol for more tips